Hi, dear students. Now I know you have seen a notice, and we all have seen a notice on the AIMS website on yesterday, and there are concerns about what is the new pattern and what is going to be asked here. Let's is analyze what the notice says, and I'll try to give you my ideas on it, that how to approach the exam now. So let's go to the notice and read it carefully. So this notice has a few parts. One is it is actually telling you that nobody will be denied admission to give the exam, so that's a good thing. And they've also defined what is a close contact of COVID-19, and they have given the guidelines. And they've gone a level up by telling that you can actually apply for a e-pass if there is some interstate travel to go to your center, and the government has already notified the required authorities about the e-pass. But the most important thing which we have underlined here for you is that they have said that in the initial prospectus they had multiple type of questions. The category number one was single best response type, and then there were categories of assertion, reasoning, more than one answer type, and all. Now they are saying that all questions will be single best answer type, which is probably to do with the entire difficulty in conducting the exam right now. I think they have limited the complexity of the exam by restricting the questions to single best response type. And they've also mentioned about those controversy that people had, that why there is a blank space on the admit card that is supposed to be left blank. Now, so this is what the notice says. Now, what I want you to know today is that a lot of students are now worried that what would happen now when they have only single best response type of questions. Now, the single best response type of paper, then that tells us that your strategy has to go back to what we were doing in the earlier days. Like if you remember that in 2 years back, the AIMS exam had a single best response type of pattern where you used to get +1 for a correct answer, -1/3 for the incorrect answer. But I would want you to again recheck this when you're giving the exam, because sometimes when you go to the exam in a scenario like this, which is unprecedented, so it is better to go to the exam and see what is the exact instructions written there and what is the exact negative marking written there. Please cross check before you start doing your paper. But if the marking is of the traditional +1 -1/3 level, which is mentioned in the prospectus also, I believe that this paper the strategy would go back to the classic exams where it was all about, aggression. Why it is about aggression is because in the classic AIMS exam, in Delhi AIMS, there are like around 50 seats for clinical specialties. So you have to go for winning. Like suppose you get a rank of 2000, you don't get anything here. So you have to get into top 50. So here the key here is you have to take chances. When I say take chances, what I mean by this is if you are able to rule out two choices, then we go ahead and do the question. Second is that in single best response type of questions, you will have all those visual questions would predominate. Like in the last year, I feel that last year they had a lot of visual questions in the single best response. Video based questions were there in single best response. So what they mean to say is that the new pattern means that the things like match the following and the more than one answer types would not be there. That is what means from this prospectus or this notice is saying. But I would again want you to recheck everything when you sit in the exam, read the instructions carefully, then start doing the paper. You don't want to mess up the paper without looking at the instructions. For example, if we have a higher ratio of negative marking, you might want to go a little bit more defensive. Right now the ratio is +1 -1/3. You want to go aggressive because the reward is more and the penalty is less. It is simple mathematics that the reward is more, penalty is less. So if I'm able to rule out two choices, I go ahead and do the paper. In the last few years that I've talked to so many of people who have done well, so many of Damsonians who have done well in the AIMS exams, and when I talk to them, most of them out of 200 questions have attempted around 195, 190 plus. So aggression is usually the key. But mind you, if the paper turns out to be very difficult, then you need to be defensive. I'll explain to you. Now what happens is that whatever strategies we will be telling you right now is all based on our experience in the past. But when you are giving the exam, if you feel the exam is of very, very tough type, that it is something like, no repeats and all new concepts, then you go a little bit defensive. Okay, you don't attempt to do the ratios in the classic manner. And if you find the paper is doable, all standard things that they're supposed to ask are being there, and then you know that everybody else would also be able to do the paper, then you need to go more aggressive. For example, I'll give you an idea. Classically, when I compare the AIMS exam and the JIPMER exam, JIPMER exam usually has, in the JIPMER PG exam, they usually have more and more newer questions and new updates and more tough paper. So what happens is, in JIPMER, the toppers are the ones who have attempted a little less. Out of 250, they would have done 225. Okay, maybe 220. Here in AIMS, because the paper classically is more doable, you will find people would have done 190, 187, 192, 195, like this. That would be the attempt ratio. But I want you to go to the exam with an open mind. Don't go to the exam with a prejudiced mind that this is what I'm going to do. Go with an open mind, read the instructions again, check mark that I have checked the instructions again, write your name properly and all those things, they go without saying, and then you do the paper to the best of your ability with a slight bend of aggression that if I'm able to rule out two choices, I'll go ahead and do it. Okay, that should be a goal. And if there is a question where all four choices you have no idea what is going on, you don't know anything about, you leave that question. In a visual question, which is always, AIMS paper classically feels like a very visual exam. It's a very visual exam usually. So in a visual question, my suggestion is look at the choices first, then look at the image. Okay, look at the choices first, then look at the image. So that when you look at the image, you already know what you're trying to rule out. Like if the choices are saying pneumothorax, pneumonia, pleural effusion, you know that I have to differentiate between these four when I look at the image. That should be your key. That should be your key strategy here. And in a video question, again, I would want you to remind you that I have seen, and you have also seen in the past, most of the video questions are just like a visual. Don't get scared in the exam if there is some moving picture. It's all, the concepts are already with you. And in the final few days, I would again want you to know that even in the last year's AIMS exam, the single best response questions were the key determinant. So now they are the only determinant. That's the only thing that has changed. Don't panic, stay positive. And I want you to know that whatever may change, if it changes for everybody, it kind of neutralizes. It's not like that for you only they are giving a single best paper and others are getting a different kind of. It's nothing like this. It's for everybody. So let's stay positive. Let's give a good exam. When I say good exam means that you should be able to do the paper to the best of your ability. You have to understand now, in a competitive exam, the outcome is not solely dependent on you. Like, let me explain to you. Suppose I give an exam to the best of my ability, but others perform better than me, they win. But that's true for any competitive game in or any exam. Anywhere you have competition, this is truth. That it is not solely dependent on you. So what you can do is you can only do the exam to the best of your ability, so that when you come out of the exam hall, you should have no regrets. When you come out of the exam hall, you should have no regrets. You should have this feeling that I've done the best possible. Now let's leave the rest to the God and let's see what the result comes out to be. Don't get overwhelmed at this moment by the results. Detach yourself from the result and focus on giving the best exam of your life. When you give this exam, you're giving this exam in unprecedented conditions. You're giving these exams with people wearing masks and face shields. You're giving the exams with fear, and there's so much concerns here. So at least you should have this in mind, that I will give the best exam of my life. I'll do my best possible, and then I leave rest to the God. I have no regrets. The key is that the regrets don't happen after the result. The regrets happen after the exam itself. So there should be no regrets. You should manage your time well. You should be, when an AIMS exam where it is a lot of visual kind of a paper, usually it is always a good idea to, start at a good pace. It should be like that. Some children, what they do is in the first 10 questions, they take so long, and in the last 50 they have very little time left. So you should have that well planned approach, that you should be going at a fair pace from beginning itself. Plan your timing well, take care of yourself, and this from the behalf of entire DAMS team, which includes the faculty team, the non-faculty team, we wish you all the best for your upcoming exam, and we also want you to be safe, take precautions. It is an exam, it's an important exam for you, I know this, but life is even more bigger than anything else. Please take all due precautions: mask, face shields, hand sanitization, social distancing. Please follow each of them seriously. And do take care of your people accompanying you as well. Sometimes you may have parents who are not medical doctors, or who are not medicos, so they may not you have to guide them accordingly to take precautions. It's just like this pandemic is not over yet. You have to take this in perspective, and the we have not reached the plateau in India so far. So the key is take precautions, be safe. You have to do so many things in life in future, so do take care of yourself and your loved ones. Give a good exam, come back straight home, and we'll discuss with you. And I wish you all the best, and do a great exam. And also keep thinking in your mind, in your free time, what will you speak when I take your interview, and what will you tell to people about your strategy and how you go about things. Try and inculcate more positivity into you. This is a time to tell yourself to kind of blind yourself to everything that is happening around, and focus on building positivity for you, so that when you give the exam you have that positive energy inside you. Visualize yourself in aims, visualize yourself doing good work. And today we know the entire world actually values medical profession like never before, and you know that you are entering a very noble profession, and you're going into further into it, into a great organization like AIIMS. Visualize yourself doing good work in a great place like AIIMS. You will reach there. I wish you all the best. Take care.